Welcome back. How do you stop balding and enlargement of your prostate at the same time? Welcome back. I'm Dr. O. I'm the internal medicine doctor here at Angelic. If you're new here, don't forget to hit that subscribe button so you don't miss any video that I'm going to release. So today we're talking about how do you naturally stop balding and the enlargement of your prostate. Yes, the treatment is the same. So let me tell you that there is a natural supplement that we can actually use to help treat this condition. So most patients, when they start noticing some balding, go to their doctor to try to get some things checked to see what might be causing it. Some people just say, oh, it runs in my family, so, I'm gonna have it, I guess, starting at age so young. And some patients notice that they are having, also at the same time that this balding thing happened, that they're also struggling with their urination, right? They're finding themselves, having to go to the bathroom often or struggle to pee because it's so slow, the stream is weak. Or you're having to wake up multiple times a night to go pee because they don't empty fully. So when the prostate issue is happening, we usually call that benign prostatic hypertrophy, which means that the prostate gland is kind of gotten really big. The muscle of the prostate gland has gotten big. And when that gets big, it causes a narrowing of the urethra with the pathway for the actual urine to flow. So as this happens, you struggle more and more with your urination. Also, you might be seeing at the same time this pattern of male baldness, right? You're losing your hair here and you're starting to comb things the other way to cover it up, or pat your hair different, or cut your hair it's different style, or have your barber do some things to kind of just darken some areas and so on. Like you start seeing yourself doing this at a young age, or older age. As we age, this happens more. So one of the causes that we found is a substance in the blood called DHT, and that stands for dihydrotestosterone. So think of dihydrotestosterone as a compound that the body makes when it converts testosterone to something else. So there is an enzyme called 5-alpha reductase that is supposed to convert your testosterone. And when this conversion happens, it converts it to DHT. And DHT has its very unique effects, but particularly on the hairline, it causes baldness when the level is too high. Okay, so we're looking in the blood and we're trying to keep your level below a certain figure. Usually around 50 is what we say. Okay, so we want to keep it below that. When it gets higher than that, it's very common for us to find balding, sometimes in men and women. Okay, and we check the prostate and we're finding that you're having problems here as well. You're reporting symptoms suggesting urinary retention in frequency and all of this nocturia where you're waking up multiple times a night. When we see that, we immediately want to go check for DHT levels. Okay, we check DHT levels and it's confirmed high. Well, with a high DHT level, that is something we can actually do. We can start to give you substances that block the DHT conversion called saw-palmetto. This is a natural supplement that you can take called saw-palmetto. Saw-palmetto is going to help inhibit the enzyme that converts the testosterone to DHT. And that will help us slow down the baldness, slow down the enlargement of the prostate, and even in some instances, reverse some of these problems. So that is something that you can do naturally. The supplement you can pick up from over the counter and start taking. The side effects are very minimal. Most patients tolerate it well, and you can usually start to see some improvement in this issue. But you should start with having your doctor check and see whether low or high DHT level is what you have going on. Of course, we're looking for high if it's the cause of balding and this enlargement of the prostate, which we call BPH. Okay, hope that helps. Let me know if you take saw palmetto and if it's helped you. Leave some comments in the section below. How many milligrams did you use? How much did you have to take before you started noticing something? That will be very helpful for some of our patients that are looking and watching this video. I'll hope to see you on the next one.